Why is Lyme disease so controversial? Lyme disease is one of the most debated topics in medicine. Disagreements exist over diagnosis, treatment, and an understanding of the disease. So why is it hard to diagnose? Well, in some cases, it mimics other conditions like chronic fatigue, fibromyalgia, endless number of diseases. Bullseye rashes are not always present. Early testing is not always reliable. Even latent testing, often you might get just an IgM, not an IgG. The tests are problematic. And the fact is that many patients go undiagnosed for months to years. Chronic Lyme disease is heavily debated. For example, the CDC and IDSA often say the symptoms are due to immune dysfunction, maybe debris. ILADS is concerned that the infection may persist, you might need longer treatment. And then there's a post-treatment Lyme disease syndrome debate, where some doctors think it's a syndrome, it's related to immune, but ILADS and others, including my practice, is that it's important to be looking for a persistent infection or co-infection that might be treatable and prevent the symptoms related to the syndrome. The fact is that 10 to 20% remain sick on long-term follow-up. Now, the treatment guidelines differ. We're so used to relying on guidelines. In this case, the IDSA talks about 21 to 30 days of treatment, maybe retreatment if there's Lyme arthritis, and then dismissing the patient as having a syndrome if they're still sick. ILADS discusses longer-term treatment, combination treatment, treatment for co-infections. There are mixed patient outcomes that are in the clinical trials that are cited. Some benefits, particularly in fatigue, and some patients remain sick with a poor quality of life. Other areas of controversy is that insurance coverage for long-term treatment can be difficult, although I find that oral antibiotics are often covered by the insurance plan. There's high out-of-cost pockets for some treatments. There's medical gaslighting, where it's difficult to find a doctor to take people seriously, and patients often struggle to find care on a timely basis, and particularly with complications of Lyme disease. There's also misinformation and online confusion. Because there's conflicting information from different experts, people rely on these online sources, and they're confusing, they're different. There have been alternative approaches that are under study. And social media spreads awareness, but they also spread fear. And the fear is in part related to how severe Lyme can be, how severe it can affect the fight or flight, the cytokines, and all those things. Plus the awareness that others are sick and that it can be difficult to treat. So the ongoing controversy reflects urgent needs. We need to have better diagnostics, more research, inclusive treatment options. The NIH trials only treated patients with IV antibiotics. They didn't look at oral antibiotics or co-infections as a treatment modality. They didn't look at combination treatments. And patients deserve clear answers and support. So thank you for joining me for this Common Sense Lyme series discussion.